How do capsule endoscopy and stool tests diagnose diverticulitis? Imagine trying to solve a puzzle about your health. Sometimes the pieces are clear, and other times they need a bit more investigation. When it comes to diagnosing diverticulitis, doctors relying mainly on imaging scans, but let's explore how capsule endoscopy and stool tests fit into this picture. Capsule endoscopy involves swallowing a tiny camera in a capsule that travels through your digestive tract, capturing images along the way. It's great for looking at the small intestine, especially for conditions like bleeding or Crohn's disease. However, diverticulitis mainly affects the colon, and capsule endoscopy isn't typically used for that. It can sometimes spot small pouches called diverticula, but it's not designed to detect the inflammation or complications like abscesses or perforations that happen with diverticulitis. There's also a small chance the capsule could get stuck, especially if there are strictures or diverticula, but this is rare. Because of these limitations, capsule endoscopy is more often used in research or follow-up situations rather than initial diagnosis. Stool tests are another piece of the puzzle. They don't directly diagnose diverticulitis but can help rule out other causes of your symptoms. For example, stool tests can check for blood, infections, or inflammatory markers like calprotectin. If your symptoms are caused by an infection or inflammatory bowel disease, stool tests can help identify that. But they can't confirm diverticulitis because this condition involves localized inflammation of small pouches in the colon wall, which requires imaging to see clearly. The most reliable way to diagnose diverticulitis is through imaging, especially a computed tomography scan of the abdomen and pelvis. These scans can show inflamed or infected diverticula, abscesses, or perforations, helping doctors decide on the best treatment. During an acute attack, doctors usually avoid colonoscopy because of the risk of perforation, but they might perform it weeks later to confirm the diagnosis and check for other issues like cancer. So, to sum it up, capsule endoscopy isn't typically used for diverticulitis because it's designed for the small intestine and can't reliably detect colonic inflammation. Stool tests are helpful to rule out other causes but don't confirm diverticulitis. Imaging scans like CORT are the gold standard for diagnosis, giving a clear picture of inflammation and complications. Always remember, if you suspect diverticulitis, consult your healthcare provider for proper testing and diagnosis. They will guide you through the most appropriate steps based on your symptoms and medical history.